Hello everybody, on this video here I'm going to talk about ankle brachial index. So this is one of useful tests that we can do, especially patients come with a diabetic foot or suffering from diabetes or any other peripheral vascular disease, or they are at risk of peripheral vascular disease. So if they complain of any pins and needles on the lower limbs, or they are swelling a lot and stuff like that, then we need to measure ankle brachial index to detect peripheral vascular disease, and we can send referrals to vascular surgeons if that's required. So now this is an extreme video, an extreme example of diabetic foot with already necrosis, but your patients will not be, this is what you want to avoid. They don't have to get to this stage. So what do I need to do ankle brachial index? I need my blood pressure cuff, and you must do it with a manual blood pressure machine. Some encourage you to do with a Doppler machine, and if you have got a Doppler machine, that you can measure very, very accurate blood pressure with a Doppler machine. But if you don't, you can still do it with a stethoscope and your manual blood pressure machine. So how do I do it? So I'll just show you on this example. I'm not actually going to measure blood pressure because I'm thinking you already know how to do blood pressure. So you do your brachial blood pressure. The patient must be calm, really, really calm, so that they don't suffer from like they are not stressed, or they haven't drank coffee or anything like that that might affect the blood pressure. So you want a really accurate blood pressure, so make sure that the patient is really calm. Don't do it when the patient has just come in, just when they are relaxed and everything, pain is under control, then you can try and do this. So we measure our blood pressure on brachial blood pressure, so we get the systolic blood pressure, and then we go to the foot. We measure our blood pressure on the posterior tibial, so it's medial malleolus, just underneath there. This pulse should always be there. You should always be able to find it. So we check that. That's where we put the stethoscope, put the blood pressure cuff here, and then measure the systolic blood pressure here. You can also use the dorsalis pedis, and you can palpate it over here and somewhere here, and then mark it, because it's sometimes a little bit difficult to find, and then you can put your stethoscope, measure blood pressure, and then look at the chart next to that's coming up next, to be able to detect which measurements you should be able to refer and which measurements are normal. Thank you.